Alright team, here are the symptoms. Secondary sclerosing cholangitis, metallosis, and tertiary peritonitis. What's our diagnosis?
Could it be primary biliary cirrhosis?
I'm thinking Wilson's disease.
Maybe it's hemochromatosis.
What about a pancreatic pseudocyst?
No, none of those. The correct diagnosis is T helper cell.
But that doesn't even make sense in this context.
Are you sure, Hawks? That seems like a stretch.
I've never even heard of T helper cell in this scenario.
Yeah? Hawks, are you sure about this?
Of course, the idiots who call out Wilson's disease tell me they've never heard of T helper cell.
Probably because the symptoms you gave us sound more like Wilson's disease than T helper cell. T helper cell isn't even a diagnosis, it's a cell.
My phone can't even pick that up.
I don't pay you to be useless. Prepare for hypophyseectomy. It's the only way to save the patient.
So much for the apologies from yesterday.
Tracy, you called me in here. What's your problem now?
Hawks, I heard you want to perform a hypophyseectomy on your patient. Are you sure about this?
Of course I am, Tracy. I've been doing this for years. Trust me, the patient has a helper cell.
I would sure hope they have T helper cell.
That's a cruel thing to say.
It would be if my philosophy was solely centered on job security for the medical profession, but the T helper cell is essential to the immune system. So I don't even see why this is an issue to you. It sounds like you want to remove the T helper cell using hypophyseectomy.
I rarely ever say this, but you have a good point. What do we tell my doctors now that they've already performed the hypophyseectomy?
Oh, God damn it. Looks like the patient is in critical condition after the hypophyseectomy. What a glorious catastrophe.
I had a feeling something wasn't right. Hypophyseectomy is not the correct treatment for T helper cell, despite what Dr. Hawks suggested.
Of course it wasn't. If anything, Hawks had no clue what he was talking about this morning, and we just permanently ruined this patient's mental health.
Let's not panic just yet. I'm sure we can come up with a better alternative. Maybe some targeted immunotherapy could work.
Let's not touch a goddamn thing yet. This is pretty serious, and we need to talk to Hawks about it.
How could I misdiagnose the patient and perform a wrong treatment, like hypophyseectomy?
Probably because you insist you're never wrong and threaten to blacklist us if we disagree.
I can't sympathize with you on this one, Hawks.
What do you think the actual diagnosis is now, Hawks?
Yeah, enlighten us.
The correct diagnosis is clearly a case of autoimmune disorder.
You're just pulling a diagnosis out of your ass in hopes of buying more time to figure out what's wrong with the patient.
Besides, you're going to say it's a rare autoimmune disorder during lunch.
Then it's probably allergies or something in the food here.
The food here rivals us for consistency, Hawks.
That's on a different spectrum, Frank. They consistently make decent food. We consistently screw things up.
I'm getting lunch. Don't follow me. Just stare out the window or something.
What about the patient?
I don't really care. I'm so hungry I could eat an entire neutron star and still have room left for more. If they're awake and conscious. Keyword here, conscious. Maybe give them a drink of water or some morphine. The last thing we need is them screaming in pain for the other patients to overhear. Do you ever feel like there's always something missing in these hospital lunches?
Not really. I just focus on my patients and their progress. Speaking of which, the oncology department is making some good strides with the new treatment protocols thanks to all the new equipment we got.
New treatment protocols? New equipment?
Wait, you're actually interested in those for once?
Not the treatments themselves specifically, but the funding. We haven't been able to afford much in forever.
Duke generously gave quite a bit of money to the hospital.
He did, but it seems like it took forever for the hospital to begin buying anything of use. And I was told they hit the limit months ago. They even bought medical scrubs and proper gear for my doctors in the operating room. I can't believe we waited several months for that.
Perhaps they've been secretly freeing up funds or anticipate a surplus in the next fiscal year.
I'm a little suspicious of that. My contract ends at the end of this fiscal year, and they're probably assuming after the investigation is over, they're not renewing it.
Wouldn't the investigation be to determine if they should fire you?
It's a contract, Johnson. If they canceled it, they know I could sue them. My contract simply ends. They're not liable for everything that's gone wrong during my time here. The investigation is clearly a sham at this point. They're trying to see if I will quit before the contract ends. They haven't even interviewed me yet for my side of the story.
That sounds pretty serious. In the midst of this, have you figured out what's wrong with your patient yet?
Patient. Oh yeah. Yeah, I'll do something all right. Talk to you later. I've just discovered something groundbreaking during lunch with Dr. Johnson.
Oh, bloody hell, Hawks. You can't just storm into the operating room like this. Where's your protective gear?
This is unacceptable, Hawks. The safety protocols are in place for a reason.
Ignoring the rules puts us all at risk, Hawks. It's not just about you.
I understand your concern, but hear me out. The T helper cell theory was wrong. It's gangliosidosis.
Gangliosidosis. What's the prognosis for that?
Prognosis. It's terminal. There's no cure. We can only manage the symptoms.
But how did you come to this conclusion so quickly, Hawks?
Because everything here is terminal, Gary. The oxygen we thrive on, the oxygen you waste from idly existing, and the oxygen this goddamn hospital wastes trying to screw with me.
That sounds like a pretty deep-rooted issue, Hawks. You could have just answered the question.
I answered a stupid question, Frank. And guess what? He got a stupid answer. Everything is transactional here, and I'm sick of it.
Hawks, you're losing your temper again. I recommend you take your personal problems outside of this operating room. What we're about to tell the patient when they wake up is pretty upsetting news.
We have to discuss this gently with the patient. There's also the unnecessary removal of the pituitary gland, which just made their last days even worse.
You know how they say there's sometimes a silver lining in bad news like this? In this case, it's the fact the hospital will glee in letting this patient wither faster than let them see justice in my termination. Wait, that's not a silver lining for the patient. It's utterly fucked. They rolled a 1 and the big war upstairs takes priority.
Hawks, you are not making any sense right now. Get out of here!
No, I'm not leaving until I'm either forcibly removed or fired. Get Tracy on the phone right now.
We don't have good phone reception down here.
I told you we should have kept the T helper cell. This area is a dead zone.
Gary, now is not the time to be intentionally stupid. Hawks has snapped.
I don't care. Hawks is doing this for attention because he is actively at war over the investigation into his conduct.
Which is why today it comes to an end. Use that phone on the goddamn wall or I will unplug the patient right now.
Holy shit, you would not do that!
I'll do anything for a Scooby snack, even if it means gracefully ending this patient's life.
Now is not the time for jokes. It never is. You kill that patient and you'll have finally taken things too far.
I'm giving you to the count of 3 to dial Tracy's office. This is officially a hostage situation.
This is evil even for you, Hawks.
I've got Tracy on the phone. She says to go to her office immediately.
Thank you. See what a simple phone call can accomplish. As for that patient, send them back to their recovery room. They've served their purpose. If it helps any, make sure to